Hi, I'm Luke Womack, president of ATX Hyperbarics. We're a standalone hyperbaric oxygen therapy clinic here in Austin, Texas. One of the main questions that we receive from both physicians and patients is simply, how does hyperbaric oxygen therapy work? So I'm here today to talk to you about the science behind hyperbaric oxygen therapy. The first point to understanding hyperbaric oxygen therapy is understanding how we breathe under normal conditions. At 1 atmosphere of pressure, which we're at right now, about 20% of every breath is oxygen. Those oxygen molecules attach to your red blood cells and are then ferried throughout the body to provide the cells with the fuel they need to do their job. So the second point to understanding hyperbaric oxygen therapy is understanding what happens when there's a restriction in blood flow. So say you break your leg. When that happens, you're going to have inflammation, and you're going to have a loss of blood flow to certain areas of your leg, which will die off. Those cells will die. In order to heal that part of your leg, you have to grow new blood vessels there to get the oxygen supply restored in order for your body to undergo a normal healing process. So this leads us to our third point, hyperbaric oxygenation. Hyperbaric oxygen therapy works by putting the body under an increased atmospheric pressure, higher than 1.3 atmospheres, all the way to 2 atmospheres. You also breathe a higher concentration of oxygen. So instead of 20%, now you're breathing 95 to 100% oxygen. Under pressure, this greater oxygen concentration is able to dissolve into your plasma and into the tissue surrounding that blood flow restriction. So the blood flow restriction is no longer an obstacle to getting oxygen into that tissue, which allows the healing process to get started much faster. Our fourth and final point to understanding hyperbaric oxygen therapy is neurovascular regeneration. Neurovascular regeneration is the growth and development of new blood vessels as a result of the increased oxygen saturation of tissue. Here's how it works. Increased atmospheric pressure forces the oxygen to dissolve into tissue and allows new blood vessels to grow. Plasma can carry 100% oxygen under pressure, and these red blood cells flow into new blood vessels. Extra oxygen is diffused into the tissue from these new blood vessels. And that is neurovascular regeneration.